It's my feel-good breakfast show.
You're with your Feel Good Breakfast Show, Expresso, right here on SABC3. Now, the common cold or flu can hit you like a ton of bricks. And the last thing you want to be doing is getting out of bed to shop for medication, honestly. And that's why taking the time now to prepare yourself for flu season may be your best defense. Now, we chat to Jackie Maiman about the medicine cabinet essentials to fight off your colds and flu during this time. Good morning, Jackie. Thanks so much for joining us.
Good morning, Tavisa. It is wonderful to be here again.
Jackie, what a time. How is lockdown treating you? Your hair looks a little different from the last time we spoke. Someone's been doing their hair?
Absolutely. So, Tavisa, I could say the same about you. You and I are very similar. As you know, our healthcare professionals out there, our pharmacists, our pharmacy support personnel are out on the front line. And for me, they are incredibly brave. And so being a person who always takes up a really good challenge, I took my pet clippers and I shaved for the brave, and I call it my COVID haircut.
I absolutely love it. You know, you and I are absolutely aligned in that regard. I'm exactly doing that, shaving for the brave and just taking our hat and our hair off, I suppose, in this instance, to all the brave healthcare professionals out there. Fantastic cause. Now, flu season is here, Jackie. Is it true that we're more likely to catch the flu in winter as opposed to the rest of the year?
So this is absolutely true, although it's not true for the reasons that many people think. So a lot of people think it's because you're going from a warm environment to a cold environment, or you're getting cold, or you're getting wet. Those are not the reasons. The actual reasons are that during winter, we tend to stay indoors. We close our windows. We all sit together. So we're in a confined space for longer periods of time, breathing each other's air. And that's how colds and flu gets transmitted between many people.
I can think of many times that I've caught the cold or flu and gone, why me? Why? What am I doing wrong? What are the most common reasons that people are actually out there catching the cold or flu?
Colds and flu are from viruses, so it's a viral infection, all right? And colds are rhinoviruses, flu is the influenza virus, but at the end of the day, the symptoms are similar, although flu is more severe. So to catch it, you need to come into contact with the virus. So this could be that you are in the room or speaking to somebody who has the flu, and it gets transmitted that way. It could also be that you've touched a handle, because viruses can also live on surfaces, as we are learning with COVID-19. So you come into contact with the flu. The flu enters your body through your nose, your mouth, or your eyes. And as you know, we're all being told at the moment to wash our hands regularly and not to touch our faces. Once the virus gets into you, then there's a couple of things that happen. If you've had that infection before, or if you've been vaccinated for that, then your body immediately recognizes it and annihilates that virus, and it doesn't go any further. But if you haven't and your body doesn't know it, then it gets into your system and it starts replicating, and then it depends whether your resistance is good or bad as to how the flu or the cold progresses.
Wow. Okay, so, I mean, it does boil down to a strong immune system. We've come to learn this. Why is it so important? I need you to stress this. Why is it so important to have a healthy and strong immune system?
Very often, and especially with colds, there is no vaccine for colds. So this virus comes into your system, and you've got a whole sort of toolbox. Now, that toolbox is your resistance, your immune system. But a number of things can lower your resistance. So if you are very stressed, if you're not sleeping properly, if you're smoking or drinking alcohol in excessive quantities, if your immune system is not being supported or boosted, if you have any underlying diseases, or you're not eating properly, not exercising properly, can you see how many different things there are that affect your immune system? And then if that immune system is not supported properly, the virus replicates, and that's when we get ill.
Sure. Okay, Jackie. Well, it sounds scary, and it just speaks to the fact that you've got to be taking care of that immune system, strengthening it, and definitely supporting it as well. So tell me, what are the medicine cabinet essentials to protect us from getting the flu as well as treat the flu?
So I would say in your medicine cabinet, an essential that you need to keep is obviously something for pain and fever, all right? For instance, a paracetamol or an anti-inflammatory. Then you need something to support your immune system during the winter. Because we all know, as much as we would love to be totally stress-free, sleeping our 8 hours a night, not smoking, not drinking, and getting plenty of exercise and fresh fruit and vegetables. We don't always manage to do that. So an immune supporting or an immune booster is always a good idea as well.
Well, I've certainly built such a good relationship with my pharmacist. I mean, you know, you can trust them with just about anything, really. What should patients then remember when they visit their own pharmacy during COVID-19? And, you know, how can your pharmacist help you during this time for those who may have not built such a close relationship with their pharmacist?
All right, absolutely. So thank you so much for asking us, because I think this is so important. I know that people are afraid to go to hospitals, to go to doctors, to go to pharmacies. But please, especially if you are on any chronic medicine, make sure you get your medicine. If you don't want to go into the pharmacy, phone the pharmacist, let them deliver your medicines to you. Please, 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 everybody that is on chronic medicine, continue to take your chronic medicine. If you're not feeling well, please, again, get hold of your pharmacy. A few tips for you to keep our brave pharmacists and pharmacy support personnel safe. If you are feeling sick, and in particular, if you have a fever, any rashes, cold and flu symptoms, don't go into the pharmacy. Rather, phone your pharmacist and let us support you from a distance. We don't want you, if you've got these symptoms, walking into a pharmacy. Because effectively, if we've had a COVID-19 positive patient in the pharmacy, the pharmacist may have to self-isolate, so you lose your pharmacist.
Yeah.
The pharmacy has to close and do a deep clean and a decontaminating, defogging. We've got very strict measures in place to make sure that we keep our customers safe. So I think that's my advice. Don't be afraid to get hold of your pharmacist, but if you're sick, don't go into the pharmacy.
Jackie, you are such a favorite of the show, and it's always so fantastic to chat to you. You make me want to just get off this chair and drive straight to the pharmacist, even if it's just to say hello.
and Tabisa,
Yes.
you're so wonderful. I want to give you a virtual hug.
Well, you know what? Look straight into your phone, because here's your hug.
Oh.
Thank you so much, Jackie
Wonderful.
Maiman.
Thank you so much.
You are such a gem from the Independent Pharmacy Association. Now, we know that the immune system plays such a vital role. It's very important that we take the right steps in maintaining a healthy and strong immune system to give it the care that it needs this winter. Now, IMMUENZA gives your immune system the support that it needs against the cold or the flu, whilst Corenza Para C assists in fighting off that winter flu. Take note of those names. You're going to need to know them. Again, thank you very much to Jackie Maiman. What a star.
Looking for immune support? Remain at your peak all year round with IMMUENZA.